everyone. Welcome to our November 2024 Ask the Expert interview series. Today, I'm happy to have a familiar face, Lion Pat Ryan from the Lexington Lions Club with us today. Pat is the
Project manager.
project manager, there you go, of the Bluegrass Lions Diabetes Project. He started that initiative. I believe the idea began 2017, maybe before, but was able to work on a grant, get that grant in 2018, and get that project on the road and started in early 2019. So thank you, Pat, for being with us today, and again talking about November and it being Diabetes Awareness Month. So thank you for coming on.
Thank you so much for having me again, Jennifer. Appreciate this opportunity to get the word out about what we're trying to do for Kentuckians.
Absolutely. So I guess first, give us the background, a little bit about why you wanted to start this program and how that evolved and how it got kicked off.
Okay. Um, my story that I normally give out is that when I was about 8, 9 years old, my grandmother came to live with us. It was me, my mom, and my sister, and she had diabetes. And one of my first duties I found out when she started to live with us, I had to go to the ice box every morning. It wasn't a real ice box. We got a refrigerator later. We get to the ice box and get her insulin out and take it to her. And she would reach over in her little um, drawer next to the bed there and grab her fixins, she called them, as her needle and stuff. And when she'd take that little bottle of insulin, and stick the needle in there, and pull it down and push it up a little bit, get that last drop off, and flick all the air bubbles out. And next thing I know, she'd take that needle and go wham, just jam it into her leg. That that got my attention. I soon found out that my grandmother wore two different size shoes. She wore a size 8 on her left foot and size 10 on her right foot because she had all her toes chopped off on her left foot. That made an impression on me also. And after a few years, it was not uncommon for ambulances to be flying up the road and stopping and whisking her off to the hospital. Uh, and her diabetes was doing a number on her heart, and she eventually died of heart disease in conjunction with diabetes. I also had an uncle had diabetes, and he had to have his left leg chopped off right below the knee. Those kinds of things really got my attention. So in 2017, when the Lions Club International adopted diabetes as one of their main causes, I was ready. I was jumping all over the folks there at the convention saying, "Hey, what can we do? How can I get involved? What's available?" And they said, "Well, we're just now getting started with it. We'll get back with you as soon as we can." So it's about a year later they sent me the application, and I worked with our local Fayette County Diabetes Coalition and the local Lexington Fayette County Health Department, and they were instrumental in providing a lot of the demographic information of leading on why we needed something like this project. And we put it all together, got it sent in, it got approved, and that was probably December of 2018. And we got a check soon after in 2019. Then we were able to purchase things, and we actually got started doing some screenings in 2019, and we were moving along pretty good. And then bam, here comes old COVID. That shut us down for a good long time. Things seemed to ease up, so we did another screening. Bam, there's the Delta COVID. That shut us down again, a bunch of months. Things seemed to ease up. We did another screening. Bam, the Omicron COVID hit. So we waited out and still probably about in 2023, we really got our legs back up on us and started going again. And we've been doing lots and lots of screenings. You mentioned this is November being the World Diabetes Month, and November 15th, World Diabetes Day. We had a lot of screenings in November, especially that week. I think we did 4 or 5. So we were really, really busy. Um, we're trying to find people that have diabetes that don't know it, and we do that every time we go out. And even if they've been diagnosed, we want to make sure they know what their A1C score number is and what their risks of diabetes are if they don't control their A1Cs. So we do free A1C diabetes screening throughout Kentucky, trying to fight diabetes in Kentucky. There we go.
Very good. Well, it's really good work and, something that we're familiar with in our vision screenings. COVID really did set us back for a few years, but I think hopefully, knock on all the wood that we can, um, we are back and happy to be able to get out and provide the services. So if you don't mind, just kind of give us a brief overview of if I were to go to a screening and wanted to sit down and participate, what what are the steps that I would go through? Kind of.
Sure. Our normal routine is we set up a registration table and we have folks there that do the paperwork for us. We have the participant, they're not our clients, they're not our customers, they're not our patients. We just call them participants. And we emphasize we do screenings, not diagnosis. It's a screening, and it will give the participant a really good look at how well their body handles blood sugar over the last 3 months. Doesn't make any difference what they had to eat or drink because it's like a 90-day average. That is great because they don't have to be fasting. They don't have to call the doctor up, get an appointment, wait in the waiting room, and then go back in the lab area and wait and maybe get the results in a day or so. But we'll get the results to them that day when they come in. So they fill out the registration paper. We explain what we're going to do, and they sign their release. We have some demographic questions. We want to know if they've been diagnosed with diabetes before, pre-diabetes. Um, and then we do the American Diabetes Association at-risk assessment. It's a 7-question paper pencil thing, which lets them know if they have a risk. And then we send them on to the next table, and that's where we do the A1C screenings. And they sit down, and we go over things with them again, what we're going to do. And it takes just a small, teeny tiny mosquito bite type of finger prick. We get 5 microliters of blood is all we need. We collect that in a little plastic tube. We put that into what we call the shaker, and we shake it up, mix the blood and the reagent chemicals, and then we're able to uh, place that deposit onto the what we call the target, and the analyzer then says, "Okay, here we go," and starts counting down. 455, 454, 453. It's a 5-minute process, and they'll know their A1C score at the end of that. During that 5 minutes, we have a captive audience sitting right across from us, and we go over diabetes, a little education time. We make sure they understand what A1C means, and we show them our scale. Uh, we have it fixed up so it looks like a stoplight. You just go down in the green area. That's the normal zone. You keep on going, do what you're doing. There's a yellow area. That's the pre-diabetes area, and that's our caution zone. And then we have the upper part of the scales, the diabetes area, and we say that's where you need maybe put the brakes on. I have to stop doing some things, make some changes. We emphasize several things. Number one, diabetes is a very expensive disease. All the medications, and if you have to miss work because of diabetes or something like that, expensive. Number two, diabetes is the leading cause of blindness. Number three, diabetes is the leading cause of amputation. Number four, diabetes is the leading cause of chronic kidney disease. Diabetes is also number five, very much directed. It's has major impact on heart disease and stroke. And the latest research now is tying diabetes with Alzheimer's. So most people by that time hear that they get the idea that maybe having a high A1C score is not too good.
Mhm.
And then we go over the idea about, well, what can I do about it? And we give them suggestions about how to lower their A1C. Best ways being staying active. You don't have to go to the gym 3, 4 times a week. Just get up off your feet, be moving around the house. Walking the dog is what really helped me get going when I had my bad uh, diabetes times. Uh, Eating the good, healthy diet, lots of fruits and vegetables, staying away from high carb stuff as much as possible, switching from a lot of the fatty meats to the leaner meats of chicken, fish, turkey, things like that. But we do tell people, we don't say, hey, you can't eat this. There's nothing you cannot have. But you got to be aware how much you have of it and how often you have it. It's common sense portion control. But you can feed your sweet tooth occasionally if you need to, or every day if you just take a little bite, maybe 2 or 3 M&Ms instead of the whole pack. So we give them advice like that. And then our third area in a screening event is our resource table. And we have lots of other resources that we hand out to the participants that help them understand more about how to eat healthy, how to maintain or increase physical activity. Plus, we also want to emphasize to them if they score in the what we call the yellow diabetes, excuse me, they score in the yellow pre-diabetes zone, we want to get them involved in the diabetes prevention program. That's the DPP program. And they're all throughout the state. Most of those are done online nowadays and they don't cost anything. Um, if they score in the red diabetes zone, we emphasize to them about getting into a DSMES course. It's a diabetes self management, education, and support class. And there they can also get help. In both those situations, the DPP and the DSMES, normally you have a group of, say, 8 to 10 of people, just like yourself, people that have some diabetes risk and so on, and they want to get better. And it's a communal thing of trying to help each other out. Like, what do you do when you go out to eat? How do you control your food intake and things like that? But then there's also always a leader, a diabetes educator or diabetes nutritionist that will help them get through some sticky points and just keep things focused and online. And both of those are pretty much a year-long project. They have a number of meetings in the first 4 to 6 weeks, and then they start to space those meetings out a little more and a little more. But they've all been shown through research to have a great impact on lowering the A1Cs. All right, so that's our uh, basic overview of what we call a screening event.
Great. So it sounds like you all provide a lot of resources to people who are in the high risk or um, early diabetes area. What recommendations, other than the things that you just talked about, would you give to someone who maybe is coming to your table that says, I do have diabetes, or I did recently get diagnosed with diabetic retinopathy? Are there any other resources that you haven't mentioned that you would definitely give to a patient or participant?
The main thing is just to make sure that they have a doctor that is following up with them. If it's a diabetic retinopathy situation, they need to be seeing a retina specialist above and beyond a regular eye doctor that does regular eye exams, but they need a retina specialist that can know the way around the back of the eye where the retina is and so on. Um, of course, we want to emphasize to the participant that if they are under a doctor's care and have been prescribed medication, be sure you take that medication. I've had a number of folks that say, well, yeah, they gave me metformin. Metformin is the number one go-to drug to counteract and help control diabetes. However, metformin is not the easiest medication to take because one of the side effects is nausea. It could be pretty bad nausea sometimes. And a lot of that is because people take it not according to the directions. They'll wake up in the morning first thing and take it. Maybe they have some other medication they take every day. But you need to take metformin along with a meal. You got to have some food in your belly. Otherwise, it's going to get down in that belly and mess it up a little bit. So we emphasize, take your medication as prescribed. There may be other medications nowadays. The hot items are the GLP-1 things like Ozempic, Majorna, and those weight loss type of things. And those have shown to be quite effective if they're under a good doctor's care, doctor prescription. One of the possibly unfortunate things is nowadays they're starting to sell these things online, and they don't have quite the oversight and control and so on. And there's really no telling them exactly what you're getting. If you get them just over the line and so on, but I would strongly encourage you, make sure you work through your own doctor's office, and they will be able to ascertain whether or not, they'll make sure you're getting the right stuff, the good medicines.
Yeah.
But they have been shown to be very, very effective in lowering weight, and lowering weight lessens your effects of diabetes, basically type 2 diabetes. Type 1 diabetes is more of a genetic inherited type situation, and keeping your weight down will help lower that A1C. But the type 1 diabetics, they have diabetes. They're not going to get rid of it, everything like that, but they can live with it. And the lower the A1C number is, it means less damage is being done in your body.
Yeah. And I would say, and sorry for the generalization, but I would say most of the people who come through, if they are surprised, they're going to be type 2 and not type 1. Just that's my assumption, but tell me if I'm wrong.
No, that's correct. Most people we see that have diabetes that didn't know it, it's a type 2 situation. Again, we don't diagnose it, but it's probably going to be that, and it's mainly a lifestyle thing of especially our Kentucky lifestyle thing of people eating probably more than they should, and not eating the more correct foods, the better foods for you, for your health, and also sitting on the lazy boy and watching TV all day or something like that. But you got to be up, you got to be active, and got to maintain a good, healthy diet.
So over time through this program, kind of how has the Bluegrass Lions Diabetes Project developed over the last 4 to 5 years that you all have been able to do screenings?
Let me see if I can share my screen here. Okay. I'm going to go to share. I'm going to bring this up. So is this on your screen now?
Not yet, no.
Well, let me lower it down a little bit here. Share.
Okay, yeah, it's starting. It looks like it's loading.
Okay.
So I see a lot of your background, but I do see an Excel spreadsheet. If you can
Trying to get over here to my full size stuff.
there we go.
Okay. So these are our results from the Bluegrass Lions Diabetes Project as of November 19th.
Okay.
That was last Thursday, I believe, and that is where we did our 180th event. And so far, we have involved right at 800 Lions throughout Kentucky and around 800 other volunteers. Now, many of the Lions volunteer over and over.
Mhm.
Some do it one time, and that's it for their area. Same thing for the volunteers. But we've involved of over 1,500 volunteers and almost 64,000, 6,400 hours of service. Mentioned the at-risk assessment that the ADA has. We've done 4,600 of those. And if you score over, if you score 5 or higher, the American Diabetes Association recommends you let your doctor know that you've taken the risk assessment and you scored 5 or higher and you have a risk. Doesn't mean you have anything or going to get anything, but it's something that your doctor should be aware of so they can make sure they follow you with that risk. So we've done 4,640 A1C exams. About 3,000, 62% have been in the normal zone. And that's great. We wish everybody was there. But we have detected over a little over 1,000 people that are in the pre-diabetes area, and that's 24%, and 690 that are in the diabetes area, 15%. So overall, 39% elevated scores. Now, some of these people have already been diagnosed with prediabetes or diabetes, and so their scores may be elevated, but not elevated to the point that we follow up with them. In the cases where somebody scores in the pre-diabetes or the diabetes zone and they have not been diagnosed previously, they're on our list to follow up. We call about 30 days later to check up on them, to see if they've been able to see their doctor, to see if they've been able to work on being more active and work on eating a healthier diet. We want to check to see if they've gotten themselves inside if they're in the pre-diabetes area, we want to see if they got a DPP class, or if they're in diabetes area, we want to see if they got into a DSMES class. And if they haven't, we encourage them once again. And then we also follow up again about 60 to 90 days, 2, 3 months later after that, to see. And we don't check on them forever. We'll try to check on them. They get information at the screening event. They get the 30-day follow-up, and they get the 60, 90-day follow-up. So we give them three shots at it. Okay, I'll take this back down unless you have questions about it.
Oh, I have a question really quick while you have it up. So I might have missed this when you were explaining the process. So if someone um, passes that at-risk score, they don't move on to get their finger pricked, or
That's interesting question. That was our original mode of operation.
okay.
That we were only going to do A1C screening on those that have a at-risk 5 or higher. Well, we started doing A1C screens on everybody, and there have been numerous situations where somebody would score below the 5, but they'd score up in here in the pre-diabetes or diabetes zone.
Okay.
So we as soon
Okay.
as we found a couple of those, we started doing A1C screens on everyone.
Okay. I think I looked at the numbers wrong. I was comparing the 4630 to 2840. But so you had 4,630 that had an at-risk score or that have
Yes,
participated total in that. Okay. Gotcha. Okay. And then
and
the elevated ARA
oh,
number is just like the high at risk, the above 4, the kind of light
right.
blue. Okay. Okay. All right.
We have performed 258 retina imagings and we found 34 that had a retina pathology, about 13%. However, we've not been able to utilize our retina camera for quite some time. Um, Over the years now, it gets harder and harder to find enough lions and other volunteers to work a screening event so that I can be, let's say, released from doing the screenings and watching over that so I can do the retina imaging. Um, Last several events, we had maybe 2 or 3 people. Whereas when we first started out, everybody was pretty excited about things, and we would have 6, 7, 8 people. And that would allow me to bring the camera along and do the retina imaging also.
Sure.
Hopefully we can get back to that one of these days.
Yeah.
We'll try.
While we're talking about volunteers, would you mind to just do an overview of um, kind of the training that's involved and then the different positions um, that you can volunteer, kind of the different stations?
Sure. We tried to do a training session a day or two before a screen event. Lately, I've been doing quick training sessions, just maybe an hour to half an hour, even before a screening event. Much better to do it the day before so we can go slow and steady and be very thorough. Have time for all questions and so on. But during a training session, everyone comes in and we go through the whole process. We give them the information, excuse me, give them the forms to fill out. We go through the at-risk assessment. They sign their informed consent papers, and then we go to show them how we set up our working area to perform the A1C screening event. Uh, we have a plastic box we call our supply kit. It's actually something I picked up from a hobby store, little plastic things like where people would keep buttons and beads and this and that and so on. But it works real good for uh, our supplies include hand sanitizer. We have what's called Chuck's pads. Those are like big paper napkins that are specially a little thicker and specially made. Um, that's our working area. We call that our tablecloth. Then we set the table. We put down the alcohol wipe, then the safety lancet. Nobody ever sees the needle. The lancet shoots out, comes retracts right away when you use it. Um, we have little 2x2 gauze pads to put on the finger after we get the blood collected. And then later on, we'll put a Band-Aid on the person. And then we have another kit. It's a big red and white box, and that's our A1C kit. Inside is the analyzer. That's the brains of the outfit. We get that out, lay it down. We have 2 pouches. There's a black and white #1 pouch that in, has the collector, the little uh, clear plastic with a little tube you got to fill up with blood. And it's got the shaker, so where you stick the blood down into the reagents. That comes out. Then we have a #2 red and white pouch that you don't open up until your blood sample is ready. And that contains the target that slips into the analyzer. Once the target goes into the analyzer, the screen on the analyzer wakes up and says wait while it goes through about 50 quality control mechanisms. And then it'll say sample. And so you take your cap off your shaker and you push the blood sample down onto the target. And that's when it starts counting down from 5 minutes. And again, during that 5 minutes, we have our report cards, they're called, that has all the information I went through before about uh, the risks of diabetes and how to bring your diabetes down. We emphasize that if they bring their A1C score down just 1%, they reduce their risks of diabetes by 37%. And after the end of the 5 minutes, we write their score on the report card and we draw an arrow right on the scale, right on that green, yellow, red traffic light looking scale. It shows them exactly where they stand on that scale. And they take that report card home with them along with their at risk assessment. And during that time, we are talking to them about the risks. And if they have an elevated score, again, we're going to check on the report card whether we recommend they go to a DPP course or a DSMES course. And we try to get them to uh, partake of some of the resources back on the resource table then also. So we go through that during the training session. We pair the trainees up. We have in a pair, we got one's going to be the first sticker on the first sticky, and then they switch around sides of the table and they go through the same thing. So they understand what it feels like and what it means, and the aspects of being both someone performing the A1C and one that is getting
Sure.
the sticky that is having the A1C test done on them. So they get both sides, and we emphasize that they, during their 5 minutes, talk to their partner and go over that report card with them so they understand what to say to the people. The nice thing is, uh, I've done this enough where I can just recite it off the top of my head, but we also have all of the information printed on the back of the report card. So I gave them a little cheat sheet they can use to go through to explain the risks of diabetes to their participant. So that's the training session. It depends upon how many people are in a training session and what their backgrounds are. If I'm training a group of student nurses or something like that, or I've done med students, physician's assistants, but I've also done just regular old people that just want to help. And so we make sure everybody understands what to do and so on. Um, but just like in a regular screening event, we tell people you don't have to participate. You can stop at any time. Um, if having a teeny tiny little finger stick done just messes you up somehow, then you don't have to do it. So we have some people during the training session that would rather do the paperwork, and we always need that. And we have people that also may want to, we call man the resource table, trying to get the proper materials to the folks that need it. So we have a big need for the stickers, but we also have a need for people to do the paperwork.
Mhm. And if it's like vision screenings, you usually have a demand for someone to kind of draw people in. People at a lot of
It's
health
good to
fairs
have your carnival barker out there.
are walking around looking to pick up the freebies that are out, but not really looking to get um, their finger pricked. But somebody good that can say, "Hey, this is takes 5 to 10 minutes. It's really easy, and wouldn't you feel better if you went home today knowing, you know, that you're in good
Exactly.
shape or
Yeah.
not?"
Yeah.
Um,
And we emphasize during the training session um, some of the HIPAA rules and regulations. Again, we work in pretty tight quarters, so we don't call out A1C scores.
mhm,
Now, if the participant wants to tell everybody in the room what their A1C score is, that's good. That's on them. That
mhm,
is their personal medical information. They can do whatever they want to with it.
right.
But we should not call it out loud.
Mhm,
We write it down on a report card. We show it to them, and we mark it on the report card where they're at. And again, emphasizing where they stand on the scale and where the risk factors are. We also emphasize with the trainees about how to protect yourself. Um, we always use hand sanitizer, and we always put on a fresh set of gloves for every participant that comes in. And we show them how to. We always have a little trash bag right next to us to put everything in and keep the tablecloth area, keep your working area cleaned up, nice and neat. And we always have a lot of extra supplies if we need them. We run out of anything or something gets soiled. Uh, One of the things we emphasize to the trainees is that once you have your sample running, then it's time to put the Band-Aid on. So you want to take the gauze off the person's finger. Don't let them lay the bloody gauze down on the working area, and then put the Band-Aid on them. And then you can take your gloves off after that's disposed of. And we emphasize also that the aspect of the safety lancet that again you're not going to be able to accidentally prick yourself as a trainee because the lancet goes right back inside, and we dispose of it right away in a sharps container built just for that. So we had a lot of there's basic precautions we go through with them. And once the score is showing up on the screen on the analyzer, we can show that to them. But then we turn that over. We take out that target for that participant and get rid of it. We turn the analyzer over because that score will keep coming up. And we don't want the next person sitting down seeing what the last person's score was. That's, again, a HIPAA precaution we put in there. So we go over all kinds of nice little things with all the people that are kind enough to volunteer with us. It's not rocket science. There are a number of steps, and that's why we want people to go through it, both as a sticker and a sticky.
Yeah.
And then quite often, then at a screening event, a new person would want to maybe watch an experienced person a couple more times, and then have an experienced person watch them as they do one or two. After they do one or two, they're pretty smooth on their own, and everything runs just like a clockwork then.
Mhm. On a typical screening, how many volunteers do you usually try to have?
We would ideally like to have two people at the registration table, four sticking stations, and at least one at the resource table. If it's a big event, we might have to maybe have a roamer, give people breaks
Mhm.
if it's real busy. Some of these go 4 or 5 hours, some quite often 2 hours. Uh, but if there's a lunch involved, we will make sure everybody gets lunch or gets a break.
Mhm.
So having 6, 7 people would be really nice.
Mhm. One last question about volunteers and then we can move on, but I know we will have a lot of Lions that watch this, so they're a very good volunteer group. Um, do you have a schedule posted anywhere that people can volunteer for certain events, or do you have an email list of volunteers that you send out there? I guess, how do you handle recruiting volunteers, or how can people find out where to volunteer?
I have trained several hundred folks to do this, and I send out a schedule of our upcoming events periodically, um, and ask people to let me know which events they can volunteer for. Um, Probably need to be doing a better job of that somehow because, like I mentioned, I'm getting fewer and fewer volunteers here lately. And what was the other part of the question?
So mainly you send out emails requesting, there's no schedule posted on the website or anything like that. They just, you will send out.
We don't post on the website anymore. We used to, uh, but that
Oh,
was costing us $200 a month for maintenance well, not maintenance, but to be able to continually adjust the website.
yeah.
Nowadays we're down, I think, $30 a month. That's just maintenance fee they call it, just to have the website up.
Yeah.
So we're able to put more of that money into testing as opposed to a website. So we don't put it on the website anymore. I could really, really use some help with social media, having the schedule up on social media. That's not my strong point. I would accept all the help I can get on that. Um, but basically, like I have people call me up and say, "Hey, we'd like to do a health screening. Want to involve get the diabetes screening in there. Can you do that?" I check my calendar, see if I have an open date and time frame available, so I can get there, and then I will let them know. For example, uh, just got a call from a fella in Harrodsburg. He's a doctor at the School of Chiropractic. That's the Campbellsville College School of Chiropractic there in Harrodsburg. And so we said yes. And so I'm in the process now of uh, getting on the Lions Club website and looking for Lions Clubs around Harrodsburg and getting their um, contact information. And probably today I'll be sending out that email, trying to recruit some of those Lions around that area. As well as I talked to the professor there, let him know that any of his students or any of the faculty, any other volunteers that want to get trained to do this, we'd be glad to train them also.
Yeah. Good. All right. Um, should I take this screen shared down, or we think we're done with
I
it?
will bring it down right and I'll stop sharing.
All right.
There we go.
Well, before we hopped on here, we were discussing some new initiatives that you're a part of as part of the Bluegrass Lions Diabetes Project, and it's kind of two statewide projects that are new and coming up. So if you don't mind, just give us a little bit of background on these projects and kind of how they have evolved and what the plans are for them in the next couple of years. I think one you mentioned was the
Sure.
Kentucky Diabetes Coalition.
Right. A few months ago, was contacted by some folks uh, who wanted me to participate in some planning for this new Kentucky Diabetes Coalition. I was interested in seeing what it was and how it would be different from the Kentucky Diabetes Network or the offices inside the Cabinet for Health, um, where they have a diabetes section already, know what the difference was. But uh, this coalition will involve all all of the statewide uh, government groups as well as the KDN. Um, we're trying to work in making sure our diabetes coalitions throughout the state are getting involved and the health departments throughout the state get involved. So when they say coalition, they're trying to involve everybody. Um, they have four, get this here, they have a vision that all people in Kentucky are equipped, empowered, and engaged to prevent and manage diabetes. And their mission is to improve health for people living with or at risk for diabetes through community engagement, education, policy advocacy, and collaboration. There's four basic areas they're working on. One is focus on health equity, especially reaching out to Eastern Kentucky, um, areas that have high target populations. High target population would include African American, Native American, Latino, Asian American, and several others. Those are priority populations, and they really want to emphasize getting help into the rural areas and in Appalachia. Also, getting help equity wise with people with disabilities, lower education levels, and lower incomes. That's the first area, health equity. Second area, intentionally engage with communities in those areas that are in the communities that are most affected by diabetes. And want to pursue a collaborative approach, use the data to drive decision making, and choose evidence based strategies. Those are the guiding principles. And I am working on the goal 2, which is diabetes prevention, because that fits in with going out and finding people that have diabetes and don't know it, or finding people with elevated A1C scores and making sure they understand how to bring them down. Um, so this is a 4-year project. It's getting started in 2024, and they have all their goals, the objectives to be met by 2028. So it looks like a big push, thankfully, in Kentucky to help fight diabetes in Kentucky. That's the way our diabetes project always explains it. We want to find people that have diabetes, don't know it, and then also if they do know it, make sure they know how they can get the best help and get those A1C scores under control. And also another item coming out of the state government from the governor's office, they have our Healthy Kentucky Home. Our Healthy Kentucky Home, I think, started in October. Unfortunately, I didn't know about it until I started meeting with these coalition people. But we found out that in January, the focus is going to be on diabetes. So we're trying to get a lot of big push for January to get the word out about diabetes and where people can get screened and where they can get their help.
Very good. So if someone is watching that is putting on a community event, how do they get in touch with you to get your services and to get that set up?
Email, phone call. Um, they can look me up through the Lexington Lions Club. Um, I don't know if you can put a phone number up there later on,
Mhm.
but my number is 859-221-1041. My email address is P-A-T, dot BLDP. That stands for Bluegrass Lions Diabetes Project, BLDP. So it's pat.bldp@gmail.com.
All right. And then if they just reach out to you, I'd say 30 days minimum before the event, so you have plenty of time to get volunteers coordinated and trained and all of that stuff. Does that sound fair or?
30 days be fair. The more time in advance we get it, the better off we are.
Yeah.
Um,
Okay. All right. Well, Pat, um, it's good to see the numbers. It looks like you all are reaching a lot of people, and we've looked at this program over 5 years, but I'd say really in the last 2 years probably have been the majority of those numbers, and that's exciting to see just how busy you've been. So that's good. Thank you for all that you do to put on this project and to help serve people of Kentucky and help fight diabetes in Kentucky.
I thank you for the ability to get the word out there. Appreciate it.
We will share this on our networks, and we hope to be able to either recruit some volunteers or recruit some events for you in the future, or at least get out the word that November is National Diabetes Awareness Month, and that if you um, don't even think you have a reason to be concerned, you should still go get tested. Just
Always a good idea to know
never
your
hurts.
A1C number. Anytime you get a chance,
So,
get tested.
all right. We are going to wrap it up there with our November 2024 Ask the Expert interview. And again, thanks Pat Ryan with the Bluegrass Lions Diabetes Project for being on with us today and for all that you do. So we will look forward to seeing Pat again next November, and we'll see if we're at, you know, what do you think the projected numbers for next year will be? What's a goal?
Well, I say we're 180 right now. I would hope we might be able to get maybe 100 more by next year.
Very good. Sounds good. Well, Pat, hope you have a good afternoon, and everyone else, hope you have a good evening, and we will see you next time.
Thank you.